Hello, family and friends. At the beginning of the month, we discussed coronary artery disease, its risk factors and symptoms. Coronary artery disease is essentially a plumbing issue where plaque, composed of cholesterol deposits, clogs the arteries, restricting blood flow. Today, we'll explore ways to naturally unclog arteries using dietary changes and highlight foods that act as natural Roto-Rooters. But first, let me share the inspiring story of Dr. Kim Williams, former president of the American College of Cardiology. In 2003, Dr. Williams encountered a patient with severe heart disease, confirmed by a cardiac scan. The patient declined traditional medical treatment, yet upon returning for a follow-up visit, a repeat scan revealed a dramatic improvement. Astonished by this, Dr. Williams inquired about her treatment, expecting a medical or surgical intervention. Instead, she shared that she had adopted the Ornish diet, a plant-based eating plan. Curious about these results, Dr. Williams checked his own cholesterol levels and discovered his LDL, which is the bad cholesterol, was elevated at 170. Motivated by his patient's transformation, he decided to transition to a fully plant-based diet. And in just 6 weeks, his LDL cholesterol dropped to 90, a remarkable reduction. This case exemplifies how whole plant-based foods can help reduce arterial plaque. These foods contain no cholesterol and are typically low in saturated fat, both of which are primarily found in meat and dairy products and contribute to higher LDL cholesterol levels. It is important to recognize that our body requires cholesterol for functions such as vitamin D production and hormone synthesis. However, the human body efficiently produces its own cholesterol, making dietary cholesterol unnecessary. The American Heart Association once recommended limiting dietary cholesterol to under 300 milligrams per day. Today, it advises keeping cholesterol intake as low as possible while maintaining a nutritionally adequate diet. From experience, I understand that transitioning to a predominantly plant-based diet can be challenging. A realistic approach is to make gradual dietary changes over time with the goal of incorporating more plant-based foods. When consuming meat, the best option is omega-3 rich fish like salmon, tuna, rainbow trout, and mackerel. These fish are a part of the Mediterranean diet, one of the most extensively researched diets. It offers a balanced approach, emphasizing fruits, vegetables, whole grains, nuts, seeds, olive oil, and omega-rich fish with occasional poultry. Join me next week as we delve into specific foods that can boost your heart health and further support cardiovascular wellness.